Hey everybody, Mark Andersen here, and I'm so glad that you're here watching Business on the Run with Mark Andersen. I've got a really cool guest. His name is Edward Davis, and he runs Eden Consulting. Most small business owners don't fail because of a lack of passion. They fail because they're running blind. I'm Mark Andersen, and I help small business owners make data-driven decisions using the information from their accounting records. My mission is simple. I want to make a dent in the small business failure rate by teaching you how to use your finances to make better decisions. Welcome to Business on the Run. I'm super excited to have you with us here, Edward. Thanks for coming on the show.
Oh, it's a pleasure, Mark. I'm glad you would have me. I'm looking forward to adding value to your viewers.
I appreciate it.
And just to see what kind of good conversations we can have.
Well, I tell you, it's funny that you mentioned that. As we were kind of getting things started, I was reminded of our phone conversation. I do these, started doing these screening calls mostly because I'm putting this stuff out on Facebook. I told you the story, but I'm going to tell them anyway.
Yeah, tell them.
Because I was trying to make sure that whoever comes on the show is not some crazy Facebook wacko, right? You and I tell you, you and I just kind of hit it off on the phone. I mean, we must have talked for 20 minutes, and then I started to pump the brakes a little bit, and I said to you, Edward, let's not talk about this stuff anymore because I want to make sure we can have this content on the show, right?
Exactly.
So I'm super excited that you're here. Here's what I want to know. Tell me about how you got to where you are right now with your business. And I'm assuming you're mentioning earlier that your wife is involved as well, right?
Of course.
Tell me the full story behind your business.
Mark, that might take the whole show up.
That's okay. That's what we're here for.
My background is just business in general. So I'm a real serial entrepreneur. I was a little kid in middle school with a backpack full of candy. I'm selling somebody something, right? So I've always had the mindset of like entrepreneurship.
Yeah.
I've owned many businesses. I mean, you named the industry, I've been in it. When MLMs were taking off, these multi-level marketing companies, I did every last one of them. Mm-hmm. Organogo, Herbalife, ACN, you name it, I was in there, right? I did my simple cost-benefit analysis, and I'm like, okay, if the benefits outweigh the costs, and I know my hustle. I know how I am when I'm into something and committed. I know I can make it work if it's a workable model, sure. Right? So I got in there. I learned some valuable lessons, right? I didn't necessarily make a lot of money with some. I made good money with others. I personally believe that you have to really find what you're really passionate about, right? And that's the lane you want to land in, because when it doesn't really feel like work and it's something that you just really, really love waking up and doing, then you'll never have to worry about hating what you do, right? And not always seeing the benefits and the fruit from that. So I've done every business. I have my own tax office. I have my EFIN and my PTIN right now, right?
What was that?
Personal tax identification number. So PTIN, EFIN, electronic filing numbers,
yeah.
Right? So I still have all my stuff. I've done healthy vending. I had over 30 vending machines at one point.
Okay.
Right? I've done luxury car rental. I had over 13 cars on Turo alone, right, for a long time, and I was making about $10,000 a month just from the car rental stuff. So all my activities I've done pretty well, and I've done a lot of real estate, 5 different markets: Oklahoma, Texas, Florida, Georgia, Louisiana.
Wow.
I've done every deal you can imagine, from creative finance, sub to and owner financing to flipping to wholesaling, to just short-term rental with the Airbnb stuff, right? Okay. You name it, I've done it.
Okay.
Right? I've done the deal. And then, of course, this healthcare space came because I started out primarily with my own training center. So I was certifying healthcare professionals with like their continuing education, doing their CPR, their BLS, their ACLS, their PALS, like mega coding situations where they're going in with a crash cart and they're trying to save a life. Uh-huh. I was the instructor that was teaching those classes. Right?
Okay.
So it allowed me to get, that was my first window into like healthcare. Okay. In terms of a scalable model, because even right now I have like 30 instructors up under me. So that's still actually a business that I still run. Yeah. It positioned me well because I literally certify thousands of healthcare professionals every year. Right. So the very people who now were once my clients for CPR or some other education are now my same relationships when it comes to referrals, right? Sending me clients to my home health or my group homes or whatever, right? So it became a pretty nice little pipeline. So my wife, let's fast forward. That my wife at a networking event for business, right?
Okay.
So at that point, she was into real estate, also into Forex trading. So she does Forex as well. She's a pretty smart little cookie, but she's really big into the holistic health space, right?
Okay.
So I call her the female Dr. Sebi. I don't know if you know who Dr. Sebi is, but so he just Google the guy. He's a real brilliant island guy who just mastered any ailment a person has. He can cure it with natural remedies, natural herbs, roots, right? Natural ways,
Gotcha.
right? Because you gotta remember that pharmaceuticals are just synthetic versions of what's already in nature.
Yeah.
God already gives everything we need to heal and to create an alkaline state of being, which no disease can exist if you know how to just create alkaline in your body, right?
Yeah.
Instead of an acidic environment, right? Well, my wife, she's a genius. She knows. I've seen her cure some things that will blow you away. She actually might need to come on your show one day.
I'd love to have
just talk
her.
about.
Yeah.
So her company is called Wellness Guide Center. So that's a whole nother brand. So she was already into wellness and healing and health, but just in that space.
Okay.
Our parents are also, one is a psych nurse, one is a pediatric nurse. So we already had kind of the team already there.
All right.
And so her parents also made a lot of money like back in the early 90s when this healthcare thing was first taking off.
Okay.
They had a personal injury clinic, they had a home healthcare agency, and they had staffing. And in the staffing company alone, they had like 300 people in the staffing agency.
Oh, wow.
So this was early 90s when things were still a lot of paperwork, right? But they made a lot of money. Fast forward now to 7 years ago. They wanted to start a lot of these businesses back up. I was already kind of dibbing and dabbing in the group home space because it already fit with my real estate. It allowed me to combine both things I love. Because the real estate, because you have to have the asset. The real estate is still an important piece of group homes, licensed and unlicensed.
Yeah.
And then of course you're adding the operations side, which you're bringing the healthcare part into it. So then they approached us and they were just like, they're old, and they're just like, so much has changed. The technology, the systems, just everything that, so we need some fresh blood to really get these things where they need to be. And I became the fresh blood. Right? Okay. So I took those businesses and I scaled because I knew business already. Yeah. And I already had a lot of healthcare exposure. Okay. Right. Plus, by the way, I also teach in pharmacy. I didn't mention that.
Teach what?
In pharmacy.
Okay.
So at Texas Southern University, my alma mater, I actually still teach. I only teach once a semester. So every spring semester. The semester just passed.
So do you do the whole semester? Or do you just go in like as a guest lecturer?
No. So I go in as a consultant / adjunct professor.
Gotcha.
So they pay me twice.
Gotcha.
That's another conversation. But I co-instruct the class with the former assistant dean of pharmacy, and another guy by the name of Dr. Harris, who just put it like this, they're so brilliant, they actually co-wrote the curriculum for the pharmacy school. Okay. Right, so these are the people who invited me along to co-instruct with them. Yeah. And so they hired me initially as a consultant because they watched what I was doing with my nonprofits and how engaging the curriculum was and how responsive the students, and because I had a prevention and an intervention side to it. Yeah. So I dealt both with the little kids that everybody don't want to deal with, right? Truancy court, alternative schools, boot camps. I was in there, detention centers, and then we started the prevention side. Because I'm like, wait a minute, we're doing a good job at getting them, and kind of changing the way they think and so they don't want to get in trouble anymore. How do we stop them from getting in trouble in the first place? So I had the whole nonprofit thing going real strong. So Dr. Harris already knew of me, so he invited me in while they was creating that curriculum, and he was like, we want to learn how you made your stuff so engaging. Okay. Because we want to bring that same energy to get the students at Texas Southern more involved as pharmacists. So that's how they initially hired me. And then they loved what I did, and they ended up just wanting to keep me. So I've been there every year now for 8 years. Cool. Doing my little segment. So again, that was all my exposure. But like I said, so when I finally came into the healthcare space, I already had a good foundation, and I just took with all the stuff that they were doing and we just put it up under one big umbrella, one kind of conglomerate, if you will. And I've been just learning these businesses and scaling them from that point going forward, right? To the point to where I was doing such a good job that old acquaintances of mine started reaching out, asking me, why don't you start consulting? Yeah. And so that's how that happened. And I think I told you the horror story of the initial home health agency that was set up. Mm-hmm. We paid over $25,000 to set up. Yeah. And the help was just I wouldn't wish it on my worst enemy. It was unfortunate at the time because of course I was upset about losing all of that money. Yeah. But the light at the end of the tunnel, right, or the silver lining was it forced me to get into the businesses and learn them because she screwed everything up. Everything that could be screwed up was screwed up. Even to the point to where on the license itself, it didn't even have the right name.
Oh man.
How do you mess that up?
That's a good question.
As an expert consultant, right?
Yeah.
I got into the business, started with the home health agency, and I learned it from the ground up.
Yeah.
All right. I got in there, I figured out who to communicate with to get the licensing corrected inside of Tulip, to the point now where I have a lot of them on speed dial. So now I actually talk to the supervisors, right? And I have the relationships. So now I can even push people's licensing through faster because I know who to communicate with.
Sure.
Right. As opposed to before, again, when I'm just trying to figure it out and depending on somebody else to do all of the work and not really understanding really, the nuts and bolts inside of the business of what's really going on.
Yeah.
So I did all of the credentialing with all of the MCOs. That means like getting a network with like insurances, Aetna, Humana, Blue Cross Blue Shield, Molina, Texas Children. I did all of that. All the credentialing, getting us on board with Medicaid, with Medicare. I did all of that, right? So like I said, I got in there and because I'm a quick study. Again, I hope by my background, I'm like a lifetime student. I have degrees and stuff I'll never use, right? When I'm in school, I hate it. And then when I'm done, I want to go back, right? So I have a lot of degrees and stuff, right? Including IT.
Yeah.
Right? So my master's actually, one of my masters is in IT.
All right.
So I used to actually develop apps and websites for companies. Now, AI can do it all for you. You don't need to hire me. I can just show you the right prompts to use, and you can have a whole team with Claude or with ChatGPT, and they could build out your whole whatever. But that's another part of my journey. But just know that in healthcare in general, I literally learned these businesses from the ground up.
So where's the location? What's the location of the business?
So we have multiple locations.
Okay. Where are they?
So we have a location by the medical center in Houston off of 610 Loop by the Chachos. We have a location Southwest Houston, which is 8700 Commerce Park. So it's kind of right off of 69, kind of in between Gessner and Bissonnette. So there's an Olive Garden and a Saltgrass right there. We're behind them. Then we have a Northside location as well, which is off of 45 and Red Oak.
Okay.
And so then I have multiple locations that I do smaller stuff out of. But in terms of the agencies, one houses the personal injury clinic and one of the home health care agencies that does every category. The other houses the home health care agencies as well. One is non-medical, just a strictly non-medical and private pay home health care agency. And then those also house the group home model, right? And then, of course, the mental health, behavioral health has its own location, but it's primarily virtual because we're licensed in 3 states, New Mexico, New York, and Texas. Okay. And the good thing about being licensed in other states, what people don't realize is that, and by the way, mental health is huge. Mental behavioral health is going to it's explosive. And it's unfortunate because of the diagnosis, right? Like by 2030, almost 1 in every 2 kids will be diagnosed with some type of being on the spectrum, right? Okay.
For autism, you're saying.
For autism, right? Mm-hmm. And then there's just so many other outlying mental issues that either go unaddressed because they're unnoticed.
So we were talking a little, wanted to interject a little there for a second because we were talking about wellness earlier. Mm-hmm. So I just want your opinion on this. How much of the autism that we experience in this day and age? Because I don't know, when I was growing up,
it was almost non-existent.
Exactly. So why is it so prevalent now? Is there something with the food that we're eating? I mean, I'm just want your opinion on it.
I'm going to give you my opinion based in a lot of fact. I don't want to go too deep into what you should or shouldn't do, but only what I know for a fact is going on. Mm-hmm. Right? The reality is, Mark, everything in society is trying to kill us. Mm-hmm. The water, the air, the food you eat, everything is just literally trying to kill you. I mean, there's so many forever chemicals, even in the clothes we're wearing. Yeah. It's kind of hard not to be exposed to some type of toxic that's causing long-term damage depending on how much exposure you're having to that stuff, right? And so the air we breathe, the water we drink, like our house, my wife is not trying to hear it. The whole house it has a filtration system. And then there's an extra filtration system under the counter, so the actual water that we drink is pure alkaline. Yeah. And that's in our house. So our whole house is set up like that.
I had heard or read a statistic about the the average human being has approximately the equivalent of a credit card's worth of plastic in their bodies at any given time. And a lot of it's got to do with the fact that we're drinking out of plastic water bottles, right? I don't know if that's true or not.
It's very true. That's also
But
another thing
it's kind of scary.
That's also another thing that's killing us. The amounts of petroleum and plastic we're exposed to. There's actually a Netflix special just came out, plastic toxicity or something like that. I gotta go back and look it up again, and I'll text it to you. But you need
Do
to
that,
watch
yeah.
it.
I'd love to.
And actually, it was a situation where they did a independent study, and they followed a group of like 5 different families. Mm-hmm. And each one of these families had an issue with fertility, with getting pregnant.
Right.
And they literally said that nothing else is coming back of concern. All of their levels and vitals are normal. They're like, the only thing that it could possibly be is the levels of exposure to plastics, right? So they did this whole study, an experiment, where they removed as much of the plastics out of their diet as possible. What they were cooking on, they would absorb plastic, what they're drinking out of, even the cookware, right? We don't realize sometimes we're cooking with plastic utensils and this and that. Yeah. And anytime that stuff is exposed to heat, it's automatically literally melting the plastic into your food.
Exactly.
Like, so when you put stuff in the microwave, for example, and it's in a styrofoam, right, plate, right, or whatever.
Oh, yeah.
Yeah, you're literally eating.
You got to put it.
You might as well just be eating plastic.
Yeah. You got to put that stuff on a glass plate. Yeah. We kind of, me and my wife have gotten to a point where we've cycled some of that stuff out of our stuff. Like we don't have like plastic Tupperware, for example, right? We have, I mean, it does have a plastic top because otherwise how are you going to, I mean, you kind of need some of that, I guess, but the base itself is glass.
Ours is the same way.
The spoons that you mentioned, spoons for like cooking and stuff like that. We've got wooden spoons.
Wooden spoons,
right?
The best.
Because you don't want to melt that stuff. But, you know, I'm not a fan of like these microwave bag things. You know, you throw them in the microwave and you just cook them and then that's it. I'm not a fan of eating any of that because you know while it's one thing to eat plastic like this, but when you heat it up, it gets even worse.
Oh, of course, exponentially. Yeah. It's ridiculous. But yeah, but
I didn't mean to turn this into
no. It's interesting
health discussion
because my wife actually she's cured people that had amazing situations that. Like this one young man, he had an issue where it was a nervous system issue, and his eyes would not stop just constantly shifting, right? To the point to where he was getting made fun of in school, right? And it was just something he just could not control. To the point to where the medical community, by the way, and I don't know if you know or not, but the average physician, they're only required to have like 3 hours of nutrition and health.
Yeah.
For a whole 12 years of school, right? Yeah. So they know absolutely nothing really about wellness and nutrition and actually curing.
Yeah.
I feel like we don't stand in a healthcare society, we stand in a sick care society. They know how to address illnesses and then medicate you for life. They call it chronic.
Yeah.
Right? But there are real cures out there. But there's no money in cure.
There's no prevention.
Yeah.
Right.
So this young guy's eyes were just rolling. To the point to where they actually said that they need to operate on him, cut him open to operate on his brain.
Oh wow!
My wife said that is nothing but heavy metals in his brain and maybe something parasites. She said he just needs to do a detox, a thorough detox, clean out his system, get that metal out, right, and flush. They document this journey, man. So watch this young man go from week 1, you see minor improvements. To week 2, by week 6, he's completely cured.
Yeah.
From something that his mother paid my wife a couple of $100 for this metal detox. Yeah. Would have changed this young man's life forever if they'd have let him cut him open and operate on his brain.
Can you imagine?
Right. So yeah, we're exposed to so much crazy stuff that and everything is really literally trying to kill you, from the forever chemicals to the plastics to parasites and things that are in the food to just the things that, just think about it like this. And it's stuff that can be prevented because Europe has thousands of things on their list that are banned from their society.
Like all the red dyes and whatnot.
And I just feel like that's a society that love their people. Yeah. I don't know what to say about America and capitalism. I can say that they can easily take stuff out that they know is actually killing us, and they choose not to, right? Whether they say it's because of the colors, it makes the colors more vibrant, and we respond better to colorful things. whatever the rationale is or the psychology is, they take it out before they ship it. They
all
take
that
it out
stuff's
before they
about
ship it to other
marketing,
places.
though.
Exactly.
Yeah.
You take it out before you ship it to other places.
Yeah.
So that means you can do it at the
course
same
you can.
cost, but you just choosing to keep all this stuff in there and kill, you know, and I mean, look at the rates of cancer and just all of the stuff that's going on. Because it ain't just the autism, it's the rates of everything that's skyrocketed through the roof. And it's like, how did we get here?
I know.
Right? When a lot of this stuff was almost non-existent back when we were
kids.
Up.
Yeah. Totally.
Yeah.
So I know we kind of got a little off on a health tangent there.
Oh, my
and
wife gonna
I
love
love
it,
that. I love that conversation. I love to have your wife on to have the same conversation. Give me like your 3 biggest, most important lessons that you've learned since being a serial entrepreneur that you would like to communicate to small business owners out there listening.
I would have to revert back to what makes a business scalable for me. It's 3 things that I found that if you have this formula down, you can scale any business, and any business can become a very profitable opportunity. And then you can duplicate that thing as many times as you like. Mm-hmm. The first thing is figure out how to fire yourself. Mm-hmm. All right. Second thing, delegation. Third thing, automation. So the lessons I learned is when you first come into these businesses, a lot of times you spend a whole lot of time working in them than on them. Mm-hmm. The business can only scale as much as far as your skill sets and the amount of time you have in a day will allow. You have to learn how to make a business scalable and to be able to duplicate yourself. And if you can't duplicate yourself, which, you know, cloning is legal, but I don't know, you know, in some parts of the world anyway. So I don't know if you want to go there yet.
You can't physically clone yourself.
You just make 10 of you real quick. But you can clone the processes and the systems, right?
That was what I was going to ask you about, because that's how you're doing it, right? You're doing it through process, because once you got that stuff written down and other people can follow the process,
the SOPs.
That's when you're able to really start scaling. Right. What are some of the mechanisms by which you've implemented processes, right? Because you can't do the same thing for every process, right?
Right.
I mean, some of it's different. Some of it's even circumstantial in nature. I would imagine in your business, like someone has some sort of a cardiac event, for example. I'm sure there's a process to deal with that, which would be different than closing the books for the month, right?
Right.
So those processes would be
right.
very different processes to document. So tell me about how some of the things that just the different ways that you've gone about getting your processes in place.
Compliance is the biggest issue.
Okay.
Because the state will come out to see you. Mm-hmm. They typically won't come unless somebody calls them and complains, like a client that wasn't getting a good service for some reason, or feel like there was some level of exploitation, neglect, or abuse, right? Mm-hmm. But automatically they will come out when it's time for renewal and those general times of auditing. When you set these businesses up, I'm going to be honest with you, Mark. My hat goes off to the people who get into these businesses because it's real work. Mm-hmm. A lot of people get into it because it's just trendy. It's like, oh, that sounds cool. I'll just start me a home health agency or a group home or a non-emergency transportation service. Or I like the sound of mental health, behavioral health. I just want to, And even people who actually have the licensing, they might be a licensed therapist or something, and they don't understand that those skills are not transferable. Being a good therapist is a skill set. It's not the same as running the business.
No, it's not.
And I've watched so many of them flop, fall on their face, then come back to get somebody like me to come in and help them structure things on the operations side and the business side. So again, when you get into these businesses, compliance is everything. Yeah. Because in the eyes of the state, if you didn't document it, it didn't happen.
Right.
And so what you document protects you. So you want good systems that help with documentation because it can get tedious. Right? You got to keep track of all of the clients, all of the employees. Every month you have to run OIG checks on your employees.
OIG.
OIG. So it's the ombudsman. So it's an internal audit because there's a database, a statewide database. Mm-hmm. Actually, it's federal level. If anybody's ever been penalized for any kind of neglect, abuse, or exploitation of any client ever, their name will go in that registry.
Oh, okay.
And that means they are officially on the do not hire list.
Right.
You have to run that OIG check before you hire them, not after. Because if the state, because everything is date stamped. Mm-hmm. So when the state comes through the door and they say, "Oh, I see you hired Tom on the 4th of May, but you didn't run the OIG check until the 10th." That means you had this man working in somebody's home
For 6
a
days,
vulnerable client for 6 whole days, and you didn't know if this man was a murderer.
Yeah.
Or if he had, the previous client, he stole everything in the house, right? And so they take that real seriously, right? So everything has to be done before the actual hire. That means your background and criminal check and an OIG check, checking that database. But the database has to actually be ran monthly, even after they're hired. Because something could pop up later that wasn't necessarily there when you hired them, right?
Yeah.
Or it might have just happened before you hired them, and because you didn't check the next month.
So your people are constantly getting checked every month.
But there are systems that do that for you.
Sure. And that's where some of the automation has to come in, right? Okay.
So that's why I'm giving you a good example
Okay,
of if you have to manually.
That's a lot of work.
Yeah.
So you've got your people in a database, and if they pop on that list, you get
flagged,
an email or something,
and then we have to give them their walking paper.
Okay.
We have to sever their relationship because we can't legally. We're out of compliance as an agency, and that can cost us way more than their little paycheck.
All right.
And so we want to protect the whole business, right? Not just no matter how good of a person you are, I understand that.
Yeah.
But I can't legally keep you going into a patient's home,
right,
when you've already been, in so many words, convicted.
Yeah.
Of abusing a client before in the same situation.
Yeah.
So they have to be immediately terminated. If that flag comes up and replaced. But there are many systems like that you have to keep track of, because there are things when it relates to compliance that you have to do monthly or quarterly.
Okay.
And you want to at least have a system that if it doesn't do it for you, at least notifies you.
Yeah.
So all of those are systems and automations that are already in place.
So
even
tell me
people
more.
clocking in and clocking out, right?
Okay.
You have to track that, especially through Medicaid, if you're billing for Medicaid, because there's been so much fraud in Medicaid. I mean, look how many people have just swindled Medicaid out of billions of dollars.
Yeah.
And they're just recouping fractions of that as they're catching it. And their systems are getting better too, but it's still way behind. And so you have a situation where they're now trying to track that effectively and to make sure that they're paying you for the exact work that you actually did, not overpaying you and not paying you for work that you didn't do at all because nobody was really even there. You just gave us some random numbers that we have no way of verifying.
Yeah.
So they have actual EVV verification software where the person literally has to go to the home. They have an app that they clock in with, and the app literally GPSes their coordinates. So you know that they're literally inside of the patient's home, or they can't even log in.
Right.
Once they clock in, they have to also clock out from the same place. Some of the software actually would take a picture with like, right? So you know that they're here, or if they just pulled up. So all of that stuff, again, if you had
automations.
All of that's automation.
Are there other automations that you guys use?
I can name a whole lot.
Name one or two more. Name one or two more. Yeah, and then we'll go back to delegation, because that was the other thing that was actually number 2. So you mentioned firing yourself.
So let's go back to the staffing side.
Right.
For example, we have a whole system in place that literally does all of the onboarding for us, right?
Okay.
So our staffing agency, we can staff anywhere in 48 states. The only state we can't staff in is Oregon.
Okay.
Our insurance doesn't cover it. I don't know why. Oregon just has some weird laws. No offense to Oregon, y'all good people, but hey, that's the only state we're not licensed in for staffing healthcare professionals. We can go anywhere across the United States and staff. We have software that when it comes to onboarding, say as a travel nurse assignment, and we're trying to send them to Arizona. We have software that literally does every single check and credentialing for that potential hire.
Yeah.
So it's going to check everything. It makes them upload all of their current documentation, their licensing, make sure everything is active and current. Any kind of BLS or CPR and any of the certifications, like any certification they have to upload to the system.
Okay.
Any testing they need to do. Say for example, with staffing them, it was actually like a hospital in Arizona, but it was actually on a reservation.
Okay.
You have to go through cultural training because how you deal with that demographic is different, right?
Okay.
On the reservation, and you just out there in the middle of nowhere,
Yeah.
right? Surrounded by mountains. It's just you and the locals, the native people, right? You have to have a certain level of training and education before you go.
Okay.
All of the education you need, all of the certificates you have to do, all of that is already in the system. So literally when you apply for the job, they literally log into their own portal and they go through the whole process and it automatically qualifies them or tell them what's outlying and they still have to put into the system before they can go on this assignment.
Yeah.
Right? But the system does everything.
Nice.
Like literally they don't have to turn anything into me at all. Right? Cool. And now it's to the point to where a lot of the systems you also can now also build through the systems too. So not only does it house all of the credentials for the candidate, it now links them to the job assignment and then also can automatically bill through the system.
Okay.
Right? But this technology, Mark, is second to none. And the way AI is going and the way it's exponentially growing month after month, I mean, it's just either get on board or become a dinosaur.
Sure.
You can't, there's no way around it. Just like when cell phones first came out, or computers,
yeah,
you got to be using it.
you got to be using AI these days. You really, really do.
And now they're integrating AI actually into the healthcare software itself.
Yeah.
So you actually have an AI assistant inside of the software also helping you with tasks.
Yeah.
You know, so it's just
Amazing stuff.
Yeah, amazing stuff.
It really is. Now circle back to delegation, because I'm sure that's part of how you fire yourself, right? So tell me about your process, your delegation process.
Hiring the right people, Mark.
And do you find that to be a hard thing?
One of the hardest.
One of the hardest parts about being a small business owner is hiring good people, isn't it?
Even in healthcare, even hiring, you know, you're just caregivers, right?
Yeah.
Nobody who's like a key player necessarily. I mean, I consider all my people key players. I have the Martin Luther King philosophy, right? If you're a street sweeper, be the best street sweeper in the world. I'm going to treat the janitor in my business, in my building, the same way I treat the CEO.
Sure.
Right. Everybody's making an honest living. Everybody's hard working. Everybody deserves decency, respect, and consideration. Right?
100%.
And to have some level of dignity. So I treat nobody differently, right? So I consider my lower level workers that are just plain caregivers, maybe going in just doing assistance with daily living. They're not doing anything that requires a license. They're just caregivers, right? Mm-hmm. They may be getting paid $15 an hour. I still consider them an extremely vital part of the business, because if they don't go out to see that client, I don't have a client, mm-hmm. right? And that means I got to go out and do the work, or somebody else, right? Yeah. So everybody's important in terms of what they do to keep this thing working like a well-oiled machine, right? I said all that to say this though, even on that level, right? Somebody who's not necessarily a key stakeholder, that could be a nightmare.
Yeah.
The logistics of managing schedules and get who's going where, and managing call-offs and weekend schedules and night shifts, or if the client wants to live in, right, with it, that you have to charge a whole different thing for, finding that level of caregivers who take the job seriously enough and also is dependable and reliable enough to not be calling at the last minute or just not showing up at all.
Yeah.
Right. And now the client is calling you like, I thought, I have 40 hours this week. I was supposed to get 8 today. Nobody showed up. And you're like, oh my God. Right. So yes, the nightmare, if it's not done properly, is finding just good help.
Yeah.
Right. And that's on every level.
Yeah.
From the base level tasks all the way to, key stakeholders right, in the business. So my process is pretty rigorous. I'm just a no nonsense kind of person. And so me,
what does that hiring process look like for you?
So for me, it's a few rounds of interviews. Then I'm going to end it by making a democratic decision with other key holders, right? So for example, I would not hire a nurse without running it by my DON. Mm-hmm. She supervises all of them. She's the director of nursing. She's in the field. She does the admissions. She does, right? So she has a finger on the pulse of the people and what's going on. I'm not in the field like that, right? Sure. So it would be foolish for me to say, I just did an interview. I just got some Indeed ads come in, and, some responses, and I just did a couple of interviews. We're gonna hire Sarah and Bill tomorrow, right? And one is starting as the RN, one is starting as a CNA. Without talking to my DON, right?
Yeah.
So I make sure that she gets on that call, and she can also, screen and get a feel for these individuals that she has to supervise.
In my opinion, that does at least two things. Right. And I do a similar thing for my hiring, and I'd love to hear what your thoughts are on this. But first of all, she got to have some input to make sure she's getting people that fit in and work well with whatever their needs are. Right.
Right.
But then they also are assuming a certain level of responsibility assisting you with that hire. Right. Because if you make that hire and they don't work out, they're going to blame you. Right. But now if they've got buy-in, it's like they're as responsible as you, right?
Exactly.
And I do a similar thing with my team. I just recently hired somebody, and I'll tell you, I also do it a little bit differently than of late, because I've gotten burned with some hires, and we talked a little about this when we had our initial call. I have my bookkeeping team. If they're going to be working directly with my bookkeeping team, I give my bookkeeping team the chance to interview the person that would be supervising them before I hire them at all, right? Matter of fact, usually I do it in a way that they interview them first. I kind of think of it like, when you go to the restaurant and you see these guys that are just jerks to the waitresses and waiters. If you're going to behave like that, I definitely don't want you working for me.
Agree 1,000%.
So if they don't get along with my people, they don't get a call back. I guess the other twist that I've kind of added to my mix, because I'm hiring accounting people. It's so easy for people to say, "Oh yeah, I can do that," and then you hire them. And you find out yours is a little different because you've got these certifications, and I think that the pool is screened to a certain degree for you
already,
right?
Because
I don't get that
certain
luxury.
level of licensing to even qualify.
So one of the things that I've started to do is hire people as contractors initially.
That's another thing we do.
And if you're a good fit, you get to stay. You've got a 90-day probationary period. Because the way that I
almost
look
like
at
a temp agency.
Yeah, I'm like, you know what? Many people can probably clear that first interview. They sit in front of you for an hour or 2 hours, whatever that time frame may be. But you know what? You can't fake it for a whole quarter, right? You can't fake it for a quarter. So right. Whatever your problems or performance issues are, they're gonna come out
always,
sooner or
guaranteed.
Later. So that's kind of the tack that I take now. So
I'm gonna show you another thing we do too. We also give a little, I guess, exam, if you will.
Oh, we do that too.
And a part of that is hands-on, and a part of that is also paper. And I also learned that from the CPR training centers, because even when they come and get their continuing education stuff, they're doing ACLS, which is Advanced Cardiac Life Support. Right, you're working in a team environment, and you have to know those codes, how to read those algorithms. Know if it's bradycardia, tachycardia, cardiac arrest, what's going on, and how to respond, right? And you're doing that in a team situation where there are multiple roles, right? Somebody's controlling the airway, right? Intubating or bagging. Somebody's defibrillating, right? Just doing compressions, right? Somebody's managing the AED or the manual defibrillator and actually giving a shock. Somebody's administering meds. Somebody's recording to document what have we tried, what haven't we tried, so we can save this person's life. And then you typically have the physician or the head doctor that calls the shots. We call them the coach. So it's a whole team dynamic going on there, right? But you have to really know what you're doing, and possibly in multiple roles, because you never know which role you might end up having to play, right, in a real life situation. When they come into tests, we have an actual station set up where they got to literally go through various scenarios, right, to test out to see, are you proficient, right? Can you handle the situation? Did you recognize accurately what the code was? And then respond according to what needs to be done, whether meds need to be administered, amiodarone, epinephrine, whatever, how many rounds of CPR and compressions, how many rounds of defibrillation before we move to the next phase, right? So I got that honestly because I came up in a background where the certifications that I was giving people actually required them to still test out to show proficiency in those areas before they got the certification. Yeah. So I kind of brought that same kind of model into what we do. So I think that's what should be done always. Even when I was doing the coding stuff, because when I first started, when I got my master's, I went to work for a few companies first, right? Especially when I was just getting familiar with not just HTML and CSS, but trying to also now get into Java and other coding languages. So I went to work for a couple of companies, and you go in there and I sat at the computer and they had a whole situation.
Sure.
This is what's going on with the software. We have scanning software. So when you go to the stores and you
barcodes,
right? Yeah. So we have barcodes, right? So but there's a couple of bugs here. I need you to get in there and try to figure out how can you debug this and figure out what's actually wrong with this code, right? Yeah. So you got to get in there and figure it out. And if you can't, then it's like you say you have a master's degree, sir, right? So I learned from those models that the best way to weed out the ones who really not who not built for it, not ready, quick skill test, and you know immediately.
I stole that idea from my wife. She was telling me that because I would hire. I went through a run where I didn't end up hiring them, but maybe I did have one hire that didn't really work out at all, right? And she was like, well, what we do at the schools, we give a skills test. So then I was like, okay. But I will tell you a funny story about doing a skills test, and I ended up totally. I had my gal Melissa do a skills test for our current accountant Paul, and he blew the skills test. He did. The task was to do a bank reconciliation. Pretty simple, right?
Reconciliation.
In QuickBooks, and he didn't make it. She just shook her head and said, "Okay, he didn't do it. He didn't do it." But I knew, talking with him, that he had the accounting chops to do what I needed him to do, and to learn that system was really a small hurdle to get over.
Right.
Right. So I
like
just
that,
asked
though.
her a point blank question, and I said, "Look, I know he blew the test, but let me ask you just a basic question. If we just kind of throw that out for a second, did you like him? I mean, was he okay? Do you think he'd be somebody that you could work with?" And sure enough, she said yes. And I said, "Okay, look, so let's give him a shot and see what happens." And now, over a year later, he's still with us.
That's a great story. And again,
yeah.
you do have those exceptions. And unfortunately, sometimes if you have too strict of a system,
Yeah,
you can't lose good people.
Sometimes you got to know when to kind of, okay, I know my process says this, but my gut's telling me something different, and here's why. I think you're as small business owners, we follow our gut sometimes.
And you have to follow, and that's the balance, right?
Yeah.
So I agree with that too. That sometimes you can't be so rigid.
Yeah.
That everything has to be by the book, and there's no room for
Yeah.
being flexible, right, and making exceptions.
If that was the way that it was, anybody could be a business owner, right?
And then I agree with that too, because I'm gonna be honest with you, some people they're just terrible test takers.
That's true too.
They just crash and burn,
Yes.
because there's so much pressure, and they just don't do well when they feel like, oh, this is a test.
Yeah.
I've had situations where I didn't tell a person it was a test and just gave them something to do, and it was a test, and they was blew it out the water, and then to let them know it was a test, you watch them just sweating bullets, and it's like you really are not gonna pass this thing because you're just afraid of the idea of taking a test, right?
Tell me about some of your biggest business challenges. It doesn't matter when it was in your career, but what are some of the biggest challenges that you've faced? Just one or two examples.
So biggest challenges definitely are coming into these businesses and having to learn them from the ground up.
Yeah.
And how that whole thing started. Like I said, which is now a blessing because it allows me to be who I am right now and to consult in the space on every level.
Yeah.
At a high level. That was a challenge that I wouldn't wish on anybody because, like I said, it's just like.
But it made you who you are today.
It's just like getting dropped in the middle of the Congo or China, and you don't know a lick of Mandarin. And like figured out, and you just like,
all right.
Oh, but I know how I'm built, so I know that I can figure it out. My mom used to always make fun of me because she used to always say I'm the one kid she don't worry about. She's like, you just a go-getter, man. She's like, the rest. She's like, your other siblings, I don't know. She said, but I could drop you off anywhere in the world butt naked.
And you'll figure it out.
You're going to figure it out.
Yeah.
I don't have to worry about you. You are going to make it. So she's proud of me for that. She know I just have a don't quit attitude, and I can figure anything out.
And you can't. Yeah. I mean, as a small business owner, you've got to figure out a way to get through it. You got to plow through it somehow, right? I mean, that's just the end of the story.
So so that's definitely was a huge challenge. Just the learning curve and learning anything new.
Yeah.
Especially when you get blindsided and you just kind of get thrown into something.
Yeah.
But again, I turned that into what we have right now. Outside of that, biggest challenges would be the first audit, as well as just, again, understanding how serious the hiring process has to be when you're trying to find quality individuals.
Yeah.
It's hard to find good people, Mark.
It really is.
And when you do, you better do what it takes to keep them.
Keep them, sure.
And so for me,
agreed.
Yeah, once I find a good person, it's enough money for everybody. You don't have to be greedy. You don't have to nickel and dime a person to death. I don't mind giving up, coming out the chute, telling the person, man, I'm willing to pay you this. And they're like, are you sure that these numbers are right over here? I'm like, yeah, because when you know what you have, again, it's just important because they're going to bring so much more, right? In terms of when you create that synergistic effect, when 1 + 1 = now 4 because of what the value they bring.
Yeah.
And when you're able to just recognize the value in a person. So one thing that God gave me, I have a real good discernment of spirits. I'm really grateful for that I could really walk into a room, read the whole room quickly, and also with a 5-minute conversation with a person, I kind of already know who I'm dealing with.
Yeah.
Right. I've learned to really be able to separate the wheat from the chaff real quick. And that has helped me in so many ways to be able to really recognize real value, right? And those that can really bring something to the table, especially canceling out my weaknesses, right?
Yeah.
I'm like, man, you are really, I need you, right? So what is it going to take?
Yeah.
But yeah, but yeah, staffing has been a huge challenge, and you still have those headaches because I didn't get into the group home side of things, and when you're staffing, I mean, when you have people in the home and it just becomes chaotic. Somebody comes in drunk,
Yeah.
right? Don't follow the house rules. Somebody's still on drugs or whatever, or some other wild and crazy act that's going on in the house, and you have to now. Your house manager it's beyond their pay grade and they can't handle it. And now you have to now figure out how to. I have some stories for you, Mark.
I bet.
For me, it's just learning how to really walk upon the earth lightly and not let anything overly stress you out. Right? Everything is manageable. Everything is solvable. Almost nothing is an irrevocable or a fatal error.
Right.
Right. Even in these businesses, most people want to just say, they wait for the perfect time. And they're just they're just like, I still don't have this.
There's never going to be a perfect time to start your journey.
Exactly.
Right?
So for me, it's getting in there because a lot of this stuff you actually can learn as you go.
Yeah.
Right. As long as you have the good bones in place, the rest of the stuff you can go.
Yeah.
You can be already doing this thing and maybe even making money and kind of failing forward, but you can go.
Yeah. But we talked a little bit before we came in here about some not-for-profit stuff that you're doing. You're doing some work in Africa. Can you talk a little bit about that?
I'm basically about to take this whole healthcare thing kind of global. And again, this was something that was already in the works a while back. So I had a huge nonprofit. One was called Recreating Me, and some of the stuff is still out there, and also Solid Minds. And these two nonprofits, one focused again on prevention, one focused on intervention. And the intervention side, I had a whole team. I'm talking about full of mental health therapists, LCDCs, which is licensed chemical dependency therapists, anger management specialists, everything you needed to get the job done. I had the whole team, right? We were boots on the ground. We had Fort Bend sold up. We were in every alternative school, every boot camp, every truancy court. I stood in front of Judge Schaefer's court, actually held her gavel. You know, judges don't let you play like that. But I'm actually in truancy with her gavel, and she's like, you need to give them something so they don't come back, right? My whole team, they called us out, and she said, you can have the whole stage. Yeah. The floor is yours, even my gavel in my seat. I'm like, wow. So that's how effective we were. On the prevention side, we were in like 16 schools before COVID.
Okay. 4
churches, about 2 foster care homes. COVID knocked the wind up from under the sails. To the point to where Harris County still wanted us to come in and do a program. I declined it because I said that I know my program works best if I'm in their face.
Okay.
Virtually
doesn't work as well.
Not when you're trying to get at the hard heads, right? The people, the youngsters out there who are straight A and honor roll and they doing the right thing. But the ones who are already getting in trouble, you got to come at them a different kind of way, right? And I knew that virtually it wouldn't be effective. So I'm like, I'm not in it just for the money. Your contract looks really nice, and it was a very nice big contract. But if I did it just to say I got a contract with you, and I'm going in and I know I'm not being effective, I'm doing a disservice to them and to my company. So I declined the whole contract because COVID was still in play. And even though they were opening things back up, they didn't want us to go in right then. They told us to ask, could we do it virtually? And I was like, no. So again, all of that spun off, of course, with the CPR stuff too, to now taking that, to Africa. Africa is in need of so much when it comes to awareness and education, just basic health awareness and education, right? So what I'm putting in place right now is going to keep me pretty busy, and it's actually bringing just more of what we already doing over here and what's normal for us to places that they don't have that level of exposure to the information. Right. There's still a lot of education that needs to be put in place to help people to be able to actually, again, make a healthier environment, save more lives, right? Because even over here we have that problem. Some states require every public place to have an AD machine, and some states actually, you can actually look at the information. Per capita, the amount of people in a state that has their citizens or at least certified with basic CPR, the response rate and the survival rate is through the roof compared to the states that don't require it. There's not as many people walking around that are certified to respond quickly to somebody who's in trouble. Yeah. So even over here, we have big gaps that could be filled in terms of education and going into these smaller remote areas and smaller towns. So just imagine these other countries where they're way behind us and they need so much. So it presents a great opportunity for them to grow and build a healthier and more and a better quality of life. And it's also an opportunity for us to go over there and provide much needed skills, services for everything that they still need, whether it be infrastructure, whether it be, like I say, various trainings and certifications and institutions. But all of that stuff is needed. So yeah, awesome. So I'm in the works right now, just putting all of that stuff in place. And we'll be actually making a small transition around this time next year to start doing more visiting as we're setting things up.
Tell me a little about your faith, because you mentioned, I know you said wheat to chaff, separating the chaff from the wheat, and you mentioned God a couple of times here and there. Tell me a little bit about your faith.
The only reason that's a little hard to discuss is because I know what I believe, right? Mm-hmm. And as a man of God who in every way tries to be as Christ-like as possible, I also know that there's a lot of other beliefs out there. I try to move more with a spiritual focus, knowing what I believe, but also trying to make sure that I don't turn anybody else off, right, in the process. So I believe that religion and politics are like really, really touchy topics, right? If I said I was a Trump supporter right now, I might get death threats in a minute, right? So, I mean, you know what you believe, you know what grounds you. What moves you. And so I try to just kind of keep it there in a broader sense. Jesus never said anything about calling himself Christian or we're Christians, right? Him and the 12 disciples were just people doing the work of God. Mm-hmm. In fact, the whole idea of Christianity itself, the word Christian came about way later with Barnabas and Paul at Antioch. No, the word had never been mentioned before then, right? So everybody before that followed Christ were just people who followed Christ, right? Sure. When they asked Christ, well, how we know, we looking for the second coming. When will you come back and how we know, how we recognize you? And they were like, they trying to look for any signs. And Jesus said something that was amazing. He just said pretty plain and simply. He didn't say they're going to call themselves Christian or Muslim or Jew or Buddhist or whatever. No title. He said, a good tree can't bring forth bad fruit, nor can a bad tree bring forth good fruit. He said, watch the fruit basket. So what I do with people that come around me is I watch what you produce, right? You can't say you're an apple tree, but you're growing bananas. Yeah. I'm gonna question your fruit basket, right? Sure. So I'm just a person who I'm heavy in my faith. I believe what I believe. I know what I believe, and I know that it works, right? But when it comes to how I interact and engage with others, I pretty much just watch your fruit basket. And because that fruit basket's not gonna lie to me. It'll tell me who you follow and what you and who you are and what you're made of. Right? Yeah. I don't know if that answered your question, but
well, you answered it fine. I was going to give you an out and let you know that, you know what, and we can certainly cut that whole discussion out of there if you'd prefer. No, it's fine. I very much believe in Jesus Christ myself, and Amen. Heard you talking a little bit about it, and I appreciate that. And some, it depends. Some people want to talk about it, and some people are
I actually have an honorary doctorate in theology. Yeah, I've studied that Bible front to back. Yeah, in various languages, the Aramaic, the Hebrew. Like I'm a real scholar, man. Yeah, because when I put my soul on the line, I gotta know. Oh yeah, I just not play with. I'm not listening to who said what, because 2 Timothy says study to show yourself approved. Yeah, right. That means you got to do the work. You got to get in there and read and find out what God is telling you. Sure, the pastor, hey, he's not the gatekeeper, right? No, she's not the gatekeeper. They can be a vessel as well. But just understand you got the same access, right? You got the same power, right? Yeah.
You do. Yeah, I mean, a lot of people don't realize that,
Christ said, these things I do, you also can do in greater works. Yeah. We don't talk about them kind of scriptures because we scared of that kind of power. Yeah. Right? We don't want to walk in that kind of faith that, wait a minute. Yeah. So anyway, I want to start preaching.
All right. Edward, last thing. For those that want to do business with you, how can they get in touch with you?
Pretty simple. EdenConsults.com, right? So Eden, EDEN, like the Garden of Eden, which has a lot of connotations and significance for me. Consults, CONSULTS.com. All of my brands will be there under that one umbrella. Also, you can look up TrueSanctuary.com, Yvette Health and Allied Services, all of my brands. But my phone number, 832-829-8899, which is my business number. I'm on all social media, LinkedIn included, thousands of followers. I have so many products out there. I've written 9 books, 3 of those on every platform out there. Amazon, Barnes & Noble's online. You can find it everywhere. I have online courses. 2 of my courses are the highest rated courses on Udemy right now. So I'm everywhere. I mean, my branding, just Google me. Dr. Elwood J. Davis, something gonna pop up. But In general, EdenConsults.com will get you to the landing page of all of my brands, and it kind of spins off from there. I have 1 million emails and 1 million, business models. So it'd be hard for me to give you all of that stuff, but you can find me in general on social media. Edward Davis in general, you can find me under that name. Phone number 832-829-8899, and a good email, actually just info@EdenConsults.com.
Edward, I really enjoyed our conversation.
Oh, Mark, it's just not enough time, man.
I know. I could keep going for hours, man.
You've created a great thing here. I'm definitely going to help you promote and push this. I have a slew of highly qualified guests that I could line up your roster with.
I am looking forward to that. I tell you what, I'm gonna hold you to that one.
In various industries, all over the place.
Well, hey everybody, thanks so much for tuning in to Business on the Run with Mark Andersen. It was really a pleasure having Edward here with us. You can find us on YouTube at Business on the Run. And you can also find us on Spotify, Apple, and Amazon podcasts. So thank y'all so much, and we'll see you in the next episode.